Good afternoon, and welcome to the DMH DDSUS information session about the RFA for expanding access and supports for community-based substance use initiatives. Before we get started, here are a few reminders about the webinar technology. Please make sure you're using a computer or smartphone connected to the internet and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call. Questions can be submitted anytime during the presentation using the Q&A feature located on your control panel. We will answer as many questions as time allows after the presentation. For closed captioning options, select the closed caption feature located on your dashboard. To adjust your video layout and screen view, select the View feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics include introductions and an overview of the RFA. A Q&A session will follow the presentation. At this time, I would like to turn it over to Adam Bernard, Community Substance Use Disorder Lead for the Advocacy and Empowerment section of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Thank you, Dina. Hi, everyone. My name's Adam. As Dina just introduced, I'm the Community Substance Use Disorder Lead on the Advocacy and Empowerment team here at DMH DDSUS. I'm really excited to kind of give y'all a broad overview of the RFA that we've recently published about expanded community supports. There we go. Community-based substance use disorder services access for priority populations in areas with elevated rates of overdose or limited access. This is a SUPTRS grant, if that means anything to you, if you're familiar. If it doesn't, I can let you know what that means. It's a Substance Use Prevention, Treatment, and Recovery Services block grant. We can go ahead and hop to the next slide, Latoya. This is a description of what we're trying to do with this grant here. This initiative aims to expand substance use prevention, treatment, and recovery services and supports for priority populations. This includes areas of the state with elevated rates of overdose or limited access to prevention, treatment, and recovery services. We have $6 million that we're taking out of our SUPTRS block grant, and we will be awarding those to applying organizations, designations up to $500,000. There's no floor, but the maximum you can apply for is $500,000. Here's a brief rundown of the important dates that you should know. We issued the RFA on September 22nd, as you can see. This is the information session. You've already got that on your calendar, hopefully, if you're here. This is not the only time to submit questions. You can submit questions through our official question email response. There we go. Thank you, Brianna. She just dropped the instructions for submitting questions into the chat that you can see. All of those questions are due by 5 p.m. on October 6th. This gives us time to read and assess each question that is submitted, compile a document that compiles every question that's submitted, and then post it publicly as an amendment, as an addendum to our RFA. We will be posting that addendum to the RFA on October 13th, 2025. So today, if you submit a question through the Q&A pane, that question will be addressed, even if it's not addressed in this session. These questions that are submitted through the Q&A pane and all questions that are submitted through the RFA email address listed in your chat, every single one of those will be addressed. Applications are due by November 3rd by 5 p.m. of 2025, and then we anticipate being able to let every single applicant know about awards by December 12th on 2025. This anticipated period of performance for this grant does not begin until July 1st of 2026. So I do want to highlight that. Great, we can hop to the next slide here. These are the broad categories that DMH DDSUS uses to really focus on our strategic plan goals as we move through our strategic plan that was just published last year. Each of these RFAs that we've been publishing in this kind of similar category of expanding community access and supports all function to help us achieve some of the goals that were identified in DMH DDSUS's most recent strategic plan. If you're not familiar with it, I suggest visiting the DMH DDSUS website and reading through the strategic plan yourself. I think it's really exciting. It makes me really proud to work at an organization with those commitments. In those commitments, you'll find some broad categories, and you see those listed here. Treatment and recovery supports, increasing access to care, culturally competent care, addressing social determinants of health, peer support, community engagement, and social connectivity, and community building and support networks. All applications that come through this RFA are highly encouraged to address 2 or more of the following key areas. That those kinds of applications will be particularly exciting to the team that are reading these applications and will likely be scored higher on our program evaluation and proposal evaluation. There's also expanded descriptions of all of these in the RFA document themselves. So a lot of this presentation is really taking what already exists in the RFA and kind of walking through some of the broad steps of it. If you have questions about what those are, you can read in the RFA document itself for some expanded descriptions of that. And if you still have some questions about it, that's why we have that email address or this Q&A pane. All right, let's hop to the next slide, Latoya. So this part of the presentation really exists to help explain each of the pieces that we're seeking for this RFA. I'm sorry, I forgot to mute my Teams notifications here, and you know how it goes. You're doing a presentation and your notifications start blowing up. So for some folks who are on this info session, this may feel remedial or kind of going over some very basic aspects of the RFA process that you may already be familiar with. But one of the real goals for this RFA is to encourage applicants from organizations and communities that have not applied or do not currently receive state funding. We're really hoping to widen the net of organizations, communities, and partners that the state has in order to really close some of the historic gaps that exist in substance use disorder services across our state. So in light of that, I am trying to ensure that everybody has some level of familiarity with each aspect of the RFA, what we're kind of looking for when we're evaluating RFAs, and what you can provide us that will help us feel like you've given us all the information we need to make an appropriate evaluation of your proposal. So we're gonna walk through this here. You're gonna see some of my English teacher come out a little bit in this next part. It starts with a statement of need. Oh, let's go back. Sorry, one slide back. Thanks, Latoya. You're gonna explain why this intervention should be funded. That's a pretty basic understanding. It helps us evaluate if we can understand the context of your proposal in its community setting a little bit more. You can demonstrate, we would love to see how your organization has already successfully addressed similar projects that you're proposing to us. We're not necessarily asking you to replicate a project that you've already done, but giving us some context for your organization's capacity to address some of these complex issues really helps us feel like your organization might be a strong fit. And we are going to need to know how you plan to evaluate the success of your project's proposal, both with qualitative and quantitative data. I've got kind of expanded descriptions here on each slide. So I'm gonna read those out to folks. I'm sorry, sometimes it can feel pretty brutal to sit through somebody reading a slide, but I really just want to make sure that each of these broad aspects are kind of explained with as much language as we can. So what we're really looking for is an application that demonstrates clearly why a proposal is needed, how your organization is well equipped to execute it, and how your organization is going to measure that impact. It really helps us if your organization, your boots on the ground organization, helps us as the state understand some of the current gaps that exist in your community for substance use disorder, um, and steps that your organization would take to close those gaps if your proposal is funded. We'll hop to the next slide here. This next slide is just to help provide some examples about of what might be helpful justification data for your statement of need. Obviously, it's one thing to say, my community needs this. There are people I see in my life, there are people I know personally who don't have access to appropriate substance use disorder services, and I want to change that in my neighborhood. That's great. I fully hear that. It really helps us back up that claim if there's some concrete data behind some of those on the ground experiences. So I wanted to provide just some brief examples. This is not at all an exhaustive list, but some examples of some places you could turn to provide some of that kind of data-driven justification for the need and gaps that you're witnessing in your own community. DHHS's Violence and Injury Prevention Branch publishes monthly reports on overdose deaths, emergency department visits, and all sorts of other substance use related inquiries that we have at a state level that's broken down by county. I think that is a really invaluable resource to familiarize yourself with. It's disaggregated enough to be really, really helpful to community-based organizations who are really, really geographically focused. It'll also help you understand what we mean by a priority population that's geographically bound. We're trying to be as specific as we can with our language here about what we mean with priority population. This is a really, really good way to kind of understand what that means. There are some counties that are disproportionately impacted by drug poisonings, overdose rates, ED visits. That's a priority for us here at the state to make sure that there isn't that kind of uneven distribution of services, uneven distribution of access based on geography, based off of any other social determinant of health that may emerge. You don't have to use just our data or our data at all to submit your proposal. You can find other relevant and credentialed studies at a national scale, statewide scale, community-based scale, and any relevant program evaluations that your program has already done that display a real gap in services from a community level, a gap that your organization is trying to close with additional funding here from the state. Excuse me. Okay, we can hop to the next slide here, Latoya. Awesome. Strong applications are going to have a clear program design and description. What we're really looking for here is they should be reasonably detailed and realistically achievable. Your organization's program design should have a methodological consistency. So we kind of want to understand why you're deciding on the program priorities that you are, and if there's any kind of research behind that decision-making practice that you have. We also want to know what kind of anticipated outcomes that you may have from your program. Obviously, these should align with what you lay out in your statement of need. It will be a little bit of a flag for us if there's some inconsistency here. If your anticipated outcomes don't match up with what you've stated in your statement of need, then we may have some deep questions about how your program design relates to your statement of need. Okay, let's go ahead and jump to the next question here. Proof of capacity. This is a tricky one, especially for community organizations applying to state level grants. I come from a community nonprofit background. This is my first time kind of sitting on this end of this conversation. I'm used to reading RFAs from a community organization perspective, and this was always something that made me really nervous to apply to a state level grant, is a proof of capacity. So I want to demystify that a little bit for us today. We really want to know how your organization is well positioned to implement your proposal. We kind of want to know what steps you imagine your organization will have to take once you've received funding, or once you've received confirmation of funding to implement the proposal. And if that's within the scope of your program design and within the scope of your statement of need. So we recognize that small organizations, community organizations, are often funding for an expansion of services. You need funds to pull off what you're going to pull off. We just want to understand that you have mapped out your plan for how that expansion will take place, and on a kind of reasonable timeline for our project scope. Let's hop to the next one here, Latoya. We're blowing through these. Sustainability and impact. This is one that, one that can feel tricky, but also can be really, really meaningful for the application as a whole. We want to know about your organization's plans or hopes or schemes to help this program or intervention be sustainable in the long term, beyond just the scope of this RFA funding cycle. We all know that funding priorities can change from a state level. I'm sure that's not news to anybody who's on this info session. And what we're really trying to do is help kick up or expand some programs that can exist in the community that are durable and sustainable in the long run, especially if they exist to close gaps that have been so kind of entrenched in the way our community has set up. Part of what we want to know for the impact is not just the qualitative and quantitative data that you anticipate and expect. That is obviously what we want to know. But we also want to know what it might mean for community partnerships, what it might mean for your community at large to have a project or proposal like you are offering here in this RFA. We know that substance use disorder programs in particular, just like mental health programs, just like education programs, none of those exist in a silo. They're all situated in a community setting. And we're particularly aiming for projects and proposals that fill gaps that exist. I anticipate that that will have an impact on the community at large. When gaps are filled, all sorts of ripple effects carry out through the community. I'm curious about how you imagine your community will be impacted by this program existing in your region, and what it would mean for the people who are served directly, the beneficiaries of your proposal. Okay, let's hop to the next question here. Boy, I'll tell you what, we're really flying through this. Obviously, we'll have some time here at the end for a Q&A, but I may not be eating up a whole hour of your time. We'll see. Budget justification. I want to take a moment here to just state that some folks have noticed an issue when they click on the budget link, the budget template link that is embedded in the RFA. If you are having trouble accessing that budget proposal that is embedded in the RFA, we have attached the budget template directly under the RFA link. So I believe we can drop that into chat if it hasn't already, Brianna, that there's, boom, there it is, dropped in there right now. So So you can have a link there. It'll be there's a very clearly titled document that you can click on and download. That's the budget template link. This goes alongside your budget template. We want to understand why you're making the financial decisions you're making in your budget justification. Pretty straightforward. We just want to understand how you anticipate spending the funds, what you've done to kind of come up with those cost estimates, and how you're assuring cost effectiveness for each of those line item expenditures. Obviously, the more kind of clear and articulate that can be, the stronger an application will be. All right, let's hop to the last one here. Or I'm not sure if it's the last one, but the next one. Boom. Yep. This is just where you can access the RFA. This is how you can submit questions and the due date for this RFA on November 3rd, 2025. Yeah, I would like to take a minute here to just be as clear as I can be. Part of our hopes here at DMHDDSUS is that this RFA will allow community organizations who haven't typically had an opportunity to receive funding to provide substance use disorder services to be able to advocate for why they need funding. So we anticipate a really broad range of applications and proposals for how you would use this funding to close a gap for substance use disorder services in our state. There are some limitations that a SEPTRS grant brings with what expenditures are allowable and not allowable. I am not the resident expert on what those allowable and unallowable expenditures are. However, we can answer those for you here in this session. But one of the reasons that that the description of these proposal potentials are so broad is because we recognize that the community are really experts on what gaps exist in their own communities, what services can be kicked up to close those gaps, and who's best positioned to close those gaps. So we're trying to not be very restrictive about what falls under the big umbrella, as long as it's the substance use disorder services that falls under the kind of umbrella of helping folks access services and get treatment in a variety of ways, provide community supports for those individuals. Then we're curious about what your organization might be able to do. Okay, we can kick it over to the next slide here. This is where the Q&A session begins. I see that some folks have submitted some questions in the Q&A pane. I encourage you to take a moment and go ahead and submit a question. If you do, I can't guarantee that we'll address every question here in the session, but I will say on the 13th of October, when we publish answers to every question we received, we will make sure that your question is addressed as clearly as we possibly can. I want to thank everybody for hopping in and letting me kind of rant at you for the past 24 minutes. Boy, really ran through that quicker than I was anticipating. You can really get through a lot of information when you're the only one talking. Thank you for that laugh emoji. Really wild experience to not have any feedback at all. There we go. God, what a supportive crew y'all seem to be. Okay, I'm going to send a little Teams chat really quickly, and then give y'all a second to submit any Any Q&A, any questions? I see that some questions are really rolling in, so I'm just gonna read through our kind of question and answer pane here. When will awards be announced? Our awards will be announced. Our anticipated award announcements will be December 12th. You can also find that date on, I believe, on the front page of the RFA. So you don't have to just remember it from me. You should be able to revisit that date. Oh, it doesn't look like it's on the front page, maybe. But we anticipate our notification of awards to go out on December 12th. That's great. I might put a colleague on the spot here really quickly, just because I am really, really reticent to give incorrect information. But David, would you mind coming off of mute and just listing some of the things that are not eligible for funding under a Scepter's grant? It doesn't need to be a comprehensive list, but just kind of giving some folks some general guidance.
What I can do is try to quickly go down a list of what that would be. Hold on. Unallowable costs. Some of it here is advertising and public relations. Okay. Or generate unallowable. Okay, unless they meet specific purposes necessary to meet the requirements of the federal award. Automobile costs for personal use. Entertainment. So, any entertainment parties, celebrations, festivities, hiring of a band or a DJ would be ineligible. Okay. Any kind of lobbying, political activities, major alterations or renovations to buildings would be ineligible. Okay. Promotional funds such as gifts, souvenirs, clothing, commemorative items. One thing I would also mention is the purchase of vehicles requires SAMHSA's approval. And they usually require you to, they require that if you're going to purchase a vehicle, if you can't lease it, it has to be approved by SAMHSA. And you have to demonstrate why you cannot lease a vehicle. There's SAMHSA budget guidance available that I don't know if that can be, I guess, placed in this chat.
Yeah, I did provide a link to budget guidance.
Right. Those unallowable expenses are there listed, start on like page 4.
Yeah. Okay, great. Thank you so much, David. That's really helpful. I recognize that this is not, that you're not able to provide comprehensive guidance in this Q&A session. And David is really, really helpful for making sure that we're in compliance with everything. So he appreciates specificity and clarity in his answers here. I'm sorry I'm not giving that fully to you. I'm going to address some other questions that have emerged quickly here. One of the questions is, does the organization have to be a 501c3 nonprofit? our RFA states that they can be a public entity or a nonprofit or not for profit. So no for-profit entities, obviously, for public grant funds. But if you're a public entity or a nonprofit organization, not-for-profit organization, please apply. We have another one here that that states we have a lot of people with both mental health and SUD diagnoses. Can we serve them with this grant focusing on their SUD? Yeah, the answer is duly diagnosed individuals can receive these services. Of course, we fully recognize that individuals with SUD diagnosis also carry a mental health diagnosis. So we are not trying to partition those out at all. We are really trying to prioritize substance use disorder services, and that those kinds of services will need to be clearly addressed in the proposal. But yeah, certainly welcome organizations that are serving folks who carry both mental health diagnoses and substance use disorder diagnoses. Oh, I am not, okay. We've gotten this question that says, did I hear at the beginning that people receiving state funds now are ineligible? And if so, does that include county opioid settlement grants? I am really sorry if I misspoke. I did not mean to say ineligible. Folks who are receiving state funds already, certainly not ineligible. We recognize that there are organizations and service providers and all sorts of folks who are already receiving state funds that can clearly see and are well positioned to close gaps in services. We encourage you to apply. Please apply. It is not a disqualifying factor to have already received state services. One of the priorities that we do have with this RFA is providing opportunities for community organizations that don't currently receive funding for the state or currently receive secondary funding. So we're hoping to widen the net, but we are certainly not excluding folks who are already in our net. I apologize if I misspoke there. Grateful that somebody submitted that question. Are there age-specific restrictions on programs within the proposals? No, there aren't age restrictions for this. In fact, one of the gaps that some of the data shows exist in our community are aging populations. We also know that transitional age youth need a lot of support. So I am not aware of any age restrictions for our program proposals and encourage a wide polyphony of age priorities. Hey, Latoya, could we kick it back to the first couple of slides again? It sounds like some folks could benefit from seeing that. I will say that these slides will be available to everybody on October 13th when we're presenting all of the answers to all the questions. We could probably get the slides show up clearly, but so yeah, we'll make these slides publicly available. Great. Okay, we've got one question. What is the ideal length of proposal? There is no ideal length. We want it to be lengthy enough to be sufficient to state your case. There's no minimum page requirement, obviously. What we're really looking for is, are all of our questions answered? Do we have the information that we feel we need in order to assess your proposal and application? And we've done, I think, a really intense and thorough job. A bunch of teams of people have done an intense and thorough job in trying to lay those questions out very clearly in the RFA. So I recognize the RFA document is lengthy in itself. One of the reasons is because we want to be as clear and articulate as possible about what it is we're looking to assess. So no ideal length as long as it answers the questions that we've laid out. Let's see. I'm going through here and marking off. Can we award more than one organization per county? Yes, we can. If we have multiple really exciting organizations from a similar county or from the same county, yeah, there's a very decent chance that we could. It just depends on the strength of the proposal and yeah, the services that are being addressed and how compelled we are that those services that are being proposed will address some of the gaps that exist in our community. Will larger organizations that have received funding from the state be considered if they want to expand services? Yes, certainly will be considered. I encourage anyone to submit a proposal or an application that seeks to address some of the gaps that exist in current service provision. I think that those proposals will be much more compelling and exciting if you can indicate strategies that you're going to employ to close gaps that exist for priority populations that are impacted by overdose rates disproportionately. Is there a preference among priority populations, justice involved, traditional youth, rural, racial, ethnic minorities, or all equally weighted if the need is documented? It is any priority that's awarded, any preference that's awarded in our priority populations will be directly related to the need that's assessed and documented, not just in your proposal, but in our understanding of the statewide data. I hope that answers that question. What word is it that I'm saying? SUPTRS grant. SUPTRS is our shorthand for the federal block grant that we receive. I will copy and paste the name of this into the chat here so everybody can see it. It looks like somebody has addressed it in the chat already, Jennifer Mead. SUPTRS stands for Substance Use Prevention and Treatment Services. Yeah. Let's see here. Can services be integrated into existing program as expansion, or does the project need to stand alone? I see no reason why the program would need to exist as a standalone program. I am very amenable to the idea that certain programs could really benefit from strategic expansion and can leverage existing scaffolding that already exists for your program. That's going to make a pretty compelling case, particularly with how your organization is well suited and well positioned to address a gap that already exists. It seems unduly laborious to have to kick up a whole new infrastructure to provide service if you may already have existing infrastructure. All right. These are really excellent questions, everybody. Can two nonprofit organizations collaborate for this grant? If so, is only one application needed? That is a great question. Two organizations can apply and collaborate for this grant. I know that in our RFA that it states that you can leverage community partners and all of that kind of stuff. There are specific requirements for when two organizations are applying to be a part of the grant for a joint proposal. I do not know all of the requirements for those off of the top of my head, and I don't want to have to make y'all sit while I quietly read a document to see guidance for that. Some of that is contained in the body of the RFA itself. However, this is one of those questions that we'll address in length in publication. Only one application. Oh, here we go. Great. This is why you have experts on your team. Only one application is needed, but that application must include an MOU or MOA between the two organizations involved. Great. Whew. Thank you, James. Are prevention services also funded through this grant? For example, community support groups, or is it treatment focused? Yes, prevention services will be considered as part of this grant, particularly if you can make a case that your prevention services are addressing a population that isn't appropriately served. Yeah. Great. Oh, an MOU and MOA, just for anybody who might not know, is a memorandum of understanding or agreement. Yeah. What is the geographical scope of this grant? Great question. The geographical scope of this grant is the state of North Carolina. If you are an organization that has services that exist in and out of North Carolina, this RFA is specifically for services provided in the state of North Carolina. But they're provided coast to coast. How many awards will be made? That's a great question. In truth, I can't give a firm answer. I know that the answer will be at least 12. Our budget for this RFA is $6 million in total, and the maximum award that we'll be able to provide is $500,000. So that's how we get that 12 number, right? We can provide at least 12 organizations at $500,000, but we may be really, really compelled by a broad number of applications that are in the $100,000, $50,000, $200,000 range. And that greatly expands the number of organizations that we can award awards to. So the answer is at least 12, maybe a bunch, but at least 12. Can funds be used to work with special? Yeah, can funds be used to work with special populations such as the LGBTQ community? Absolutely, yes. Yep, unequivocally, yes. I think that there exists some pretty robust and important data that shows that that is one of the communities that's disproportionately impacted by lack of appropriate substance use disorder services in our state. So I would highly encourage that. Can the same org be awarded for initiatives in different catchment areas? That is an answer that I'll have to provide. In writing instead of here live. I want to get some clarity on that from my team before I kind of riff out an answer. Yes, they can. They can with justification. Okay, thank you. Goodness gracious, I'm so grateful for a smart team of people I work with. Organizations can be awarded for different initiatives in different catchment areas with justification. Okay, for a nonprofit organization, is there a length of time restriction that it has to be operating in? I'm waiting here because I'm finding myself speaking before some of my team of experts gets the chance to weigh in. And I just want to make sure that somebody doesn't have something really clever and smart to say about this in particular. It is my understanding that no, there is not a length of time. They just have to be in good standing with the Secretary of State's office and no pending debts or litigation. Thanks, James. If an organization is currently receiving SAMHSA funding, are they eligible to apply? Absolutely. Yep. Again, there's no funding that you can currently receive that's going to make you ineligible to apply. But our priorities are to give opportunities for organizations that are um, serving communities that aren't typically served by organizations that are currently being funded, or who are well positioned, who provide innovative, interesting insight into how to address gaps that have existed in our community. Can you use an MOA? Some really, really excellent questions coming in here, folks. Again, I'm recognizing that there is a whole range of questions that are being submitted here that we're not able to address. I just want to reiterate again that if we can't address your question here, that we will be addressing it in great specificity in a document that will be published by October 13th at 5 p.m. Are there specific counties that are going to be prioritized? If so, which ones? Yeah, I can say that a good indication of counties that will feel particularly compelling will be counties that are clearly documented in the data that we get from Latoya. Can we go back to that grant, that justification? It's the slide after the statement of need. The next slide here. This on DHHS's violence and injury prevention branch. They give out county data. That's how I understand what counties in our state are being disproportionately impacted by drug overdose emergency department visits. So I can say that if there is a program that is seeking to address disproportionately impacted community as borne out by the data, that will be of great interest to us. I will also say, though, that, as we know, some of the highest density of services in our state exist in communities that still have persistent gaps in service provision. So there's no county that will be excluded from consideration, obviously, even if it's a county that already possesses quite a density of services. What we'll really be trying to do and understand is how your proposal will address a gap that exists in the community. Yeah. Okay. How long is funding designated for? 1 year, etc. This proposal is subject to 3 years of funding. However, I will say that it works on a 12-month funding cycle. Those renewals year after year are subject to the availability of funds. So potentially a 3-year RFA performance cycle. However, each year's renewal is subject to the availability of funds. Yeah. That's also listed out in the RFA, just so that you know. I'm being, again, just for a lot of clarity, for-profit entities are not eligible to apply for this opportunity. Just the stated orgs that are that are stated clearly in the RFA. So that's public entities, nonprofit organizations, not-for-profit organizations. How will faith-based organizations be perceived? Just so you know, if you're a registered nonprofit entity, and you have a compelling proposal, yeah, certainly proceeds. There will be no difference in your evaluation. All organizations that offer recursive, yeah, any organization that is helping address or close a gap in substance use disorder services, welcome to apply. Are there any examples of application of this RFP, whether they were approved or not, even if it's redacted? We have some examples that are embedded in the RFA. I recognize that they are not specific for this RFA, but they give a kind of broad idea of what an application may look like. We don't currently have any examples of applications that have been accepted for this RFA because this is our first time publishing this RFA. So I can't provide any examples, even redacted ones, because y'all will be providing the first examples we have of this. And I'm sorry that I can't be more forthcoming about that. What I can say is if it's your first time submitting a proposal, if it's your 50th time submitting a proposal, what we're really, really looking for, I tried to be pretty clear about, and we've tried to be really clear about in the document itself. And that's just an application that answers those questions that we've laid out and makes a clear case about why your organization is a good fit to do that and how much money you're going to need to do it. Should the questions be on? Okay, great. We have this question, should the questions be copied over word for word from the RFA into a Word document, or can we label them by numbers? For example, C1, C2, D1, etc. It's not necessary to repeat the questions word for word in your Word document, but it is pretty essential to just designate what section you're answering with headers. So yeah, we're going to be reading a whole host of these applications. Obviously, I think the current participant level is still hovering around 300. So I anticipate that we'll have a large number of these applications to read. We'll understand what the questions are really well, but it would be really helpful just for our own capacity to understand the flow of your application if we understand which section you're trying to address based on headers. Yeah, just some clarity here. We cannot use the funds to purchase property, housing, land, etc. That's not allowable from SAMHSA determinations. We have a question about if we submit a 1-year budget or a 3-year budget. It is really helpful. Actually, just please submit the full 3-year timeline for your program. Many programs will just duplicate the 1 year 3 times, and that's fully acceptable, but really helps us understand budgets, applications, all sorts of things. If you just go ahead and submit a 3-year budget, yeah, but a budget for each year, as is laid out in the directions here. Great. It sounds like there are a whole host of questions that we didn't even get to address. Yes, I see that there's over 100 questions submitted. Totally makes sense. Deeply, deeply grateful for your engagement and curiosity about this RFA. I'm really, really personally excited to get to swim through the things that y'all submit for this proposal. I just, again, one last time, want to reassure you, if we didn't get to answer your question today, it will be answered in a document that will be available on the same page that the grant is available on. It'll be in that little section where RFA, then the budget line will be a next one. And then we'll have a question and an answer document that will be published on October 13th. So you'll be able to click on that document, see every question that's been asked about this RFA, and see our official position on that answer there. Again, thank you so much. Oh yes, one last reminder, this is not your only time to submit a question. You can submit a question through October 6th at 5 p.m. With that email address that we've dropped in the chat here that is available. Yeah, so please feel free to submit any questions that may emerge through October 6th at 5 p.m. Thank you so much. Tina, do you want to take it over now?
Sure. Thanks, Adam. All right. Well, as Adam said, the recording and presentation slides for today's event will be posted on the DMHDD-SUS Grant Opportunities webpage on Monday, October 13th. For more information and resources, stay connected with DMHDD-SUS by attending our monthly side-by-side webinars and joining our mailing list. The links are included in the chat. This concludes our webinar for today. Thank you for attending.